Hello, welcome to the IF Center, What If Center, What If seminar series. My name is Dr. John Lyons. I'm the director of the Center for Innovation in Population Health, and I'm happy to welcome you to the IF Center in the College of Public Health at the University of Kentucky in beautiful downtown Lexington, Kentucky. So as you may know, or maybe you don't, in case you haven't seen one of these IF seminar series before, the What If seminars are intended to look for opportunities for innovation through intersectionality. Now, before, we've always done intersectionality within species. So today, we're really quite excited to have our first trans-species intersectionality. So we have Dr. Kimberly Tumlin, who's going to talk about her work in equine-assisted interventions. So Kimberly is an assistant professor in the Department of Epidemiology at the College of Public Health, and her interest in work is around resilience and strength building as an important part of creating well-being for people. So her full introduction is going to be in the notes section on the YouTube channel, so I would invite you to read all about Kimberly's great work. But without further ado, I would like to turn it over to Dr. Kimberly Tumlin to talk about her work with horses.
Yep. Thank you so much, John, for that warm introduction. All right. So I'm so excited to be here today and to be able to share with you not only my work, but some of the other research that's out there that we could start to answer the question, what if a horse could be a better therapist than a human? So as we make this journey today, I know some of you are here who help people by utilizing horses. There are others of you here that help people through traditional services. And then I know that there's one person here that helped me through college and also supported my lifelong interest in horses, my dad. So thank you for joining today. I also see that we have some international representation. So as we take this journey together, I want you to think about what if. And I invite you to ask questions as we go along. And if you have anything specific, we will certainly have time at the end to answer questions. So what is the gap that we see in mental health services in particular? In the States in 2019, 1 in 5 individuals had depressive and anxiety disorders. And then, as we all know, in 2020, 2021, and parts of 2022, and we continue to have this collective trauma associated with the pandemic. And so what we've seen are estimates worldwide of mental illness jumping from about the 20% to 25 to 40%. And in July of 2022, we have an estimation of about 33% of the population having depressive and anxiety disorders. Now, we know that mental health needs are high, but the World Health Organization specifically says that our responses are insufficient and inadequate. So some of the reasons that the responses are inadequate is because we have barriers to care. Particularly here in the States, there are 150 million individuals who are in rural communities, and they lack the access or service coverage, particularly in mental health coverage. And so while there are community-based facilities that provide this care, not everyone can reach them. We also have a lack of trained professionals and integrated systems that would actually take an individual who are working together to provide that care between the primary care provider and the trained professionals that could deal with some of these conditions. So some of the proposed solutions that just generally exist in care systems were telemedicine. That's something that we know was very popular during COVID-19. And in fact, when we removed transportation barriers, we learned that you actually have some resolution of other needs as well. Now, the primary care provider collaborative care models are such that a lot of these conditions are associated or discovered by a primary care provider. And so one of the questions, what if questions I would present is, can we integrate systems with this primary care provider collaborative care model in which the horse might be a valuable asset to provide care? So why the horse? The picture that we have here demonstrates a lot of factors that you should consider when we're talking about the horse. Just take a moment to look at the horse's behavior, how they're interacting with the individuals here, and what they're actually doing in their facial expressions. So horses naturally are interacting in their environment using a lot of sensory integration. And they can sense heart rate up to 4 feet away. They can hear it and be able to integrate what is going on around them and be able to respond to that in the moment. Humans, we know when they have a traumatic experience, have different responses to that experience. And so we kind of see that in this picture. We have individuals who are interacting with these horses differently as they move around the entire herd. We also know that horses want to create these very complex systems of herd dynamics, and they incorporate humans naturally into this system. So, for instance, if you look at the horse that's all the way over on your left, that is kind of that brown color with the black tail, that horse's hip is relaxed. That individual is interacting with them, but they are moved away from that entire herd. So they're having a little integrative approach, but the rest of the herd is paying attention to the movement around them. Now, one of the other reasons that the horse could be really valuable in this care system approach is that most horses are in a rural environment. And so if we need services in a rural environment, there may already be organizations that are there in rural environments that could provide this care. So I want to talk just briefly about some safety, because this comes up a lot. You might think, well, what if something happens to a youth, or what if something happens to an adult that already has some physical condition? And so safety is obviously paramount, and the individuals that provide care with horses understand quite well physical safety. You have activities that are mounted and unmounted, which means that you're either on top of the horse, as we see in this picture here, or you're down on the ground, as we saw in the previous picture. The environmental space can change. It can be in an arena, which means that you're just in an enclosed area, or it could be out on a trail where you're trying to do sensory integration. And yes, I see someone actually mentioned about occupational therapy. Absolutely, horses are really good for sensory integration and changing environments. One of the things about physical safety that is important, and all facilities adopt, is using helmets. But we also know that helmets are not designed for individuals that of color, Black individuals that have hair culture, and those helmets do not fit. And so that feeds into our psychosocial safety. So imagine a youth who wants to engage in these activities, but now the helmet doesn't fit properly on them. And so they're not able to fully engage. You have some psychosocial safety challenges that feed into those participants, but also into the volunteers. So those of you that aren't familiar with this, there's usually 2 to 3 volunteers per participant that's actually receiving the care. There's staff members that are associated, and then there's the families and caregivers. And all of them are part of this complex system that are important to having psychosocial safety. Now, the horse is becoming, obviously, they're an important part of this. They are becoming more interest on the welfare. Our horses that are part of trauma-based interventions also stressed. And so we're going to cover some data to look at that a little bit. Are they free from injury? And most horses that are selected in the equine-assisted programs are older. So you're not going to go and just grab a horse off of the racetrack after the Kentucky Derby and use them in these kind of systems. You are going to be very intentional in that selection. And so we need to, as stewards of making sure that the welfare of the horse is paramount, understand how frequency of use in these different systems matter. So this slide is your take-home slide of kind of the oversight of transformation using horses. And we have the two arrows on the far left where we have an increase in these characteristics and then a decrease in other characteristics. And I've divided this into social, behavioral outcomes, biophysical outcomes, and physical outcomes. So by no means is this a representation of all the literature that is actually out there right now, but it does cover many different studies with many different populations. And what we see commonly themed throughout these studies are these concepts of bonding relationships, of motivation to heal and to engage. We see in the social behavioral this decrease in emotional dysregulation, a decrease in outburst as well. When we move to biophysical, so there is definitely a biophysical reason for why these interventions work. And so a lot of studies have looked at oxytocin and dopamine as regulators in this particular interactions. We know that the prefrontal cortex, you actually have increases in activity in that brain imaging that occurs when individuals that have gone through PTSD. I'm going to talk about the study where they're actually integrating the horse for treatment for PTSD. They're having increase in prefrontal cortex activity, and therefore that is regulating the amygdala activity, which is linked to that emotional dysregulation. So in addition to decreases biophysically, we have cortisol and norepinephrine, which are stress hormones. There's a big body of literature looking at whether or not the horse is helpful with the stress responses as well. And then probably the most foundational types of transformation using horses really started in individuals with cerebral palsy, looking at therapeutic riding and how physical outcomes, including core strength, are important. Translocational balance is something else that there's crossover in some of the work that we do with head traumas and looking at vestibular, somatic, and visual responses. And actually being on a horse helps integrate these systems so that you are actually able to respond to movement that's occurring outside of the body. And then we know that some research also shows that bilateral imbalances in strength are rectified when you're integrating with horses, and that self-harm behavior, so actually physically harming yourself, reduce as well. So terminology has been a challenge in this field for some time. For about 30 years, there's been some really great research. And this particular paper I wanted to pull out by Wood and co-workers in 2021 was published as a consensus on what kind of language we should use when we're talking about equine-assisted services and programs. And there are 3 buckets. And those are therapy, learning, and horsemanship. Now, as we move through the literature that we're going to talk about further on, you're going to note these icons are going to come back up. So I'm hoping you remember that the icons associated with therapy relate to counseling and occupational therapy with horses and other types of therapy. Now, what's important here to consider is that the language of using equine therapy means something really, really different to individuals that are providing health for horses. So, health for horses, someone that's getting equine therapy is actually about the horse receiving stem cell treatment, pharmaceuticals. They might actually be receiving some kind of physical therapy, but it's all for the horse. And so we want to adopt this language that it's therapy with horses or counseling with horses. So you're going to hear me refer to that as we move forward. Learning is exactly what it sounds like. The intent of that intervention is focused on organizational level learning, life skills, educational attainment. So communication, reading, that sort of thing. And then horsemanship is really this broad bucket of looking at adaptive sport, but also therapeutic and adaptive riding as well. And so the majority of that horsemanship is mounted on the horse unless you're doing driving, which means that you're behind the horse and the horse is pulling a carriage. All right, so we're going to go ahead and start looking at some specific studies. And in these specific studies, these are just, again, ones that I've chosen because they are somewhat comparative and to make to show you some of those transformations. And these two studies are really looking at transforming mental health in a holistic fashion. And in the first study by NACE and coworkers, what we see is that these are clinical cases. There's actually about 20 individuals that are part of this ongoing intervention, but they reported on 3 cases. These are youth that are aged 10, 11, and 12 for these 3 cases. And they actually have a very well explained integrated complex trauma intervention that is individualized. And they do both mounted and unmounted exercises. So, what they have been able to see is this increase in social functioning, coping skills, and communication that have actually occurred over this intervention, and a decrease in trauma symptoms, anxiety, a decrease in those somatic and sensory issues, and a decrease in behavioral dysregulation. So, again, looking at the whole person. Now, similarly, there were 6 youth in a qualitative and inductive approach. So each of these, as we go through, you'll see at the top what the study was about and the reference. And if you're interested in these references, we have them at the end as well. And in this study, it was also an individual approach, and they measured the outcomes relative to photo voice and semi-structured interviews. And we see common themes here: relief from anxiety, self-resilience through mutual interaction with the horse, and trust beyond verbalization that the horse is providing benefits. So when we talk about transforming PTSD or PTSS, we're now shifting this conversation into adults and looking at the first Earls, Vernon, and Yates study, where they were actually working in groups in 2-hour sessions and thinking about how long, we've got to get a kind of a dose here, how long. So these were 2-hour sessions over 6 weeks of time. And we saw a reduction in multiple trauma emotions, anxiety, depression, a decrease in alcohol use, and an increase in mindfulness in their outcomes. And then in the next study, looking at PTSD, we also had 63 adults. And in both studies, we see that their ages are very similar in terms of their mean age. And it was an 8-week intervention. And Fisher and coworkers did unmounted also. But what's really key about this study is that it's learning based. It was not focused on the symptoms of PTSD at all. So it wasn't intended to directly provide a therapeutic intervention for PTSD, but provide that learning intervention using the horse. And so they were very clear about describing the different stages that they worked through and found this decrease in depressive measures and symptom severity. So even though they weren't intending to treat the PTSD, they were seeing this difference. Now, kind of the key thing in this study is that improvements were evidenced mid-treatment, which means at 4 weeks, they were already seeing this result. So they're working in groups for 1.5 hours per week, and they're able to actually then see this reduction mid-treatment, and it was sustained for 3 months after that. The other key, really interesting thing about this study was that there are low dropout rates. And we know that engaging individuals in their care and having them actually attend their sessions is really important. And so the horse actually may provide that opportunity. So autism is another well-studied area in terms of conditions relative to interaction with horses. And in these two studies, we're actually looking at the horsemanship group. And so the first study has multiple outcomes, and they did a pre-post in terms of their time frame of measuring. And again, individual sessions looking at therapeutic riding and CBT skills. And what they saw were these reduction in anxiety, reduction in cortisol. They actually measured the hormones in both the horses and the humans for this particular study. And we see that there's an increase in oxytocin, which is a positive thing, and an increase in emotional self-regulation. Now, the horses in their analytes of cortisol and oxytocin did not change. And so this study actually concluded that there was no stress associated with that intervention with the humans. So the horses were not exhibiting stress symptoms in that particular study. And self-efficacy relative to the participants was not changed. So then we look at the Gabriel study, which is a paper in a series of papers that is a randomized controlled trial funded by the NIH, and they have 64 youth, a 10-week intervention. And what's really interesting about the control group here is that they go to the barn, so they go to the facility where the horses are at, but they don't interact with the horses. And then the other group is going to the same facility, and they're going through this therapeutic riding program. And I chose this study to talk about the 6-month follow-up because we need to understand not only when someone is in services or in the helping situation, are they improving, but does this sustain? We know that there's lifelong impacts of a negative traumatic event. And we want to know, can we intervene and can this sustain over time? And so this study provides the 6-month follow-up, and they did see reduction in irritability and hyperactivity in both groups, but they saw this sustained social cognition, communication, and word usage that was actually showing up in the therapeutic riding group only. So in this case, we see that at least the irritability and hyperactivity were similar between the two treatments, but we saw some additional benefits in the therapeutic riding group only. So going through all this always makes me go, well, what if? What if we're missing something? What if there could be more? And so some of the things that are out there include understanding about logistics of these interventions. Is it, does the location matter? When do we sample? Is it right after someone has this intervention? The sample size, you saw this variability that I just presented. What about specialized populations? We know that there's a lot of health disparities that impact care and access to care. Well, does that translate also when we're working with horses? Longitudinal studies are important. We need to work on that. Measures. So definitely, what measures should we do? And then one of the things that I'm really interested in is how do we compare and get at this question of what if the horse is better therapist, how do we compare to traditional services without creating a false environment when you're interacting with horses? In other words, you can't remove the horse, or you can't put a blindfold on and say, well, you're not interacting with a horse in this study. And so we need to come up with a way to do this. So enter our Equine-Assisted Collaborative for Health, which is a collaborative that we are working with at the Center for Innovation in Population Health, with the mission to create this space for joining people and data together so we can understand the impact of equine-assisted practices on the lives of people. We have three main goals right now is first to identify and connect people. And I'm going to go through some research and to show you how we're doing that. To share data on the understanding of who benefits and in what ways. And then we want to support the scientific advancement in this field, particularly through assistance with measurement methods and precision analytics. And I want to give a big shout out to the analytics team. We have some really great individuals, and they're helping me and will continue to help me on answering some of these questions. All right, so the first study where we have actually worked on this collaborative is looking at horse selection and organizational values. So we asked the question in this is, do facilities that are associated with a religious or faith base have different practices and values and horse selection principles than those that do not? And so what we did was a cross-sectional survey during 2021, and we reached 93 organizations, about 70% of which were affiliated with some kind of faith. And of those 70%, roughly about 71% of those were affiliated with a Christian, and the rest were did not provide a specific denomination, but said that they were faith-based. And so those are actually looking at the non-secular on the left side. That's your faith-based group. And they did value the horse selection differently than those in the secular group. And so what we see is that the non-secular was very interested in horses that are sensitive to the environment and had a history of abuse or neglect. And then the secular groups valued physical characteristics a lot more: size, bone, sturdiness, and gait and smoothness. And so we started to kind of look into this data some more and realized that the goals of these two different programs do vary. And so we want to be able to dive into this data some more. But what this tells us is when we're looking at literature and we're trying to make decisions about where should we take individuals, we might need to consider what that organizational values are, because the safety culture may vary based on what their organizational value association is. And we do know that faith and spirituality is very important to whole person health. So you may have individuals that you're interested in taking into some kind of equine assisted program that actually incorporates faith, because that's important to their culture. All right, so this is a fun, I found this a really fun study because this was using a tool that I was not familiar with. It's the PediaCats, or the Pediatric Evaluation of Disability Inventory. And there are 4 categories that are actually scored by the caregiver. And we did this longitudinal cohort study from September of 2021 until July of 2022. And we had 75 youth with multiple severe disabilities. And this was a horsemanship-based therapeutic riding program. And the scores here, I just want to give you, if you're not familiar with this particular tool, that these scores are very, very low compared to normative for the age of this cohort. So daily activities would explain like feeding yourself, being able to button your pants or put on a belt. So they're very simple activities. Social cognitive, are you able to have cognitive functioning? Mobility is, can you transfer in and out of a chair, that type of thing. And responsibility includes the commitment outside of yourself. And so what we see here is that overall, this cohort is much lower functioning. And so the question we had is, how do we predict, or can we predict, score changes based on different demographic variables, and then also their mental health diagnosis? So we used ICD-10 scores for their mental health diagnosis, and then physical diagnosis, and then we looked at time as well, like time in the program. And so what we see here is that the mental health diagnosis, so you have a reference. We did a multiple linear regression, and the reference group is cognitive disorders, because that was our largest group. And in reference to that cognitive disorder, we found that in daily activities and the social cognitive, our mental health diagnosis individuals actually had a benefit. They actually had higher scores. We could predict a 5.2 higher score in social cognitive. Well, it kind of makes sense. If someone has a cognitive disorder, they're automatically going to be a little bit lower in that category. And then the other thing that I find really interesting is we divided this study into time phases. So these are youth that are actually part of online education programs. They have severe disability during that first time frame of September through January, and then they have a blended experience, and then they're back to kind of the end COVID or normal time period. And what we see is that end COVID, that we could predict multiple point advantages in each of these categories that contribute to the overall functionality of these youth. And that's really important indirectly to the parents and the caregivers, the families and their caregivers, because they struggled a lot with depression and anxiety because they just didn't have any activities for their youth to be able to engage in. So this is a really interesting, for me, it was a very interesting study to see the benefits. Now, engagement. We mentioned this earlier of why engagement is so important in healing individuals. And what we can predict is that if individuals using this scoring system attend, they actually will have a higher functionality as they attend per day. So some of these are up to a third of a point per day. And if you think about how far that first group from normative was, if we can make that impact just by using a horse in this situation, and these data have, to my knowledge, have not been replicated in other traditional services. So this is pretty exciting. Okay, so I'm back to comparison. And I see there are a few questions. We'll answer these questions as we move on at the end. But comparison of traditional services and then services with horses. And so this is a brand new study where we looked at 29 youth in a 30-week intervention in a completely randomized pilot study. And we used the CANS. So enter our CANS tool, which is our child and adolescent needs and strengths tool. And we were using DBT in one group. So these youth are individuals who have been hospitalized for a suicide attempt. They have suicide ideation, or they were doing self-harm. And they were randomly assigned to either the group with dialectical behavioral therapy or DBT plus horses. So in the DBT plus horses, they were actually applying the skills that they were learning in the DBT to integrate the horse in that. And this is just brand new. We looked within each of the treatments, and saw that there was a total actionable need reduction. So for those of you that are not familiar with the CANS tool, there are multiple domains, and each of these domains have multiple items. And we have needs categories, which means that these are needs that are behavioral or emotional that we're trying to address. And then there are strengths. And the balance that we're looking at here is that our DBT and our DBT plus horses both had reduction in total actionable need within the CANS for similar categories. The DBT plus horses also had fewer rehospitalizations. Well, that was interesting. That wasn't the case for the DBT group alone. And the DBT plus horses had more engagement, more completion of the actual sessions in the end. So then I'm like, well, what if we're missing something? It's not just about addressing the condition or the it's about looking at what assets can we build, and are we building assets at a different rate using the horse than we are in traditional services. And so that's what the CANS gives us. It gives us the opportunity to look at strength development. And what we see is that we can predict when youth are building community life and natural support strength, we can predict a 0.45 and a 0.5 risk behavior reduction. And that is huge. That could save lives. So when we start to really apply this, and my analytics team, you guys, we've got a lot of great work we need to do with this data. We will be working on this more to really dive into this strength development, but this is promising. So each and every one of us, in my opinion, deserves to interact with a horse. But to start, our collaborative, right now, we have some ongoing projects in California, South Carolina, and Colorado, and Wyoming. And we are covering all of these 3 buckets of equine-assisted approaches. And in California, you can see some ideas about the population that we're looking at, because I'm interested again in these specialized populations. How do we tailor care? And how do we be able to provide person-centered care for individuals that maybe don't have other opportunities to in these unique systems? And so across all of these locations, we are implementing the CANS to look at need resolution and strength building. But in South Carolina, we're also looking at volunteer and parent caregiver depression and anxiety with the GAD-7 and PHQ-9 tools to start to see if there are secondary impacts here. And then the collaborative in Colorado and Wyoming, I'm really excited about, because we're working with Indigenous people, and we're looking at eye movement, desensitization, and reprocessing, both with and without horses. And in that particular group, we're using the CANS. So again, we're looking across treatments, and we're also doing heart rate variability, some biometrics, and then visual journaling. So we're doing mixed methods, qualitative and quantitative. Now, I think in one of those, are there studies that are comparing across different types of equine-assisted approaches? And this is what the intent of the each collaborative is doing at this point, so that we can actually be able to do cross-systems decision support by integrating a tool that is already adopted in the out into the residential care services and other traditional and behavioral mental health approaches as well. And so it allows us to be able to make those comparisons by not just looking at the skills that are addressed in horsemanship, or the outcomes of looking at the deficit of, say, depression or anxiety in a therapeutic approach, but allows us to actually look at what are the needs and are those resolved and moving forward. So I just wanted to end by appreciating the facilities, the organizations that have been so useful in this. I have a lot of collaborators that are out in the community. I saw some of your names pop up, so thank you so much for being part of this. For all the volunteers and practitioners and researchers that are out there, both that are working with horses and providing care without horses, because without you, we are not healing the world. So we need you. And I want to thank the other unicorns at the Center for Innovation and Population Health for helping me do this. We cannot do this alone. It requires a team. And I want to thank my horse, who keeps me well-centered, that's here, and she's always with me. And so there's a lot of other people I know that I may have missed. So I greatly appreciate you as well. All right, John.
Hello there. So that was extremely well done. Thank you very, very much. And it's absolutely fascinating. I think I'm relatively new to understanding much about equine-assisted interventions, and mostly through your good work and some colleagues that you've introduced us to. So thank you for that. We do have some questions that have come up that maybe you could talk a bit about. I think one question that came from Denise was about the straight comparisons of standard care versus equine assisted, and kind of a cost effectiveness kind of analysis. That's a little bit ahead of the literature, is it, or no? I mean, where are we right now?
Yeah. So in terms of cost effectiveness, we don't know yet what the length of stay is. So this is something I know that we talk about in the IF Center a lot, is what is that length of stay? So what is that optimal amount of time that we need for individuals to be interacting with horses in order to receive the benefits that we're trying to achieve? And so that cost effectiveness piece, I think your question is extremely valid and important, but we're just not there yet. That was why, how long are those weeks? How frequently do you have to meet? Those are questions that are just not in the literature yet.
So one of the things that struck me about the field is it's a very passion-based field. I mean, there's people who just love what they do, and they donate their time, and they raise funds, and they provide the services free. Is that a part of the secret sauce, you think? I mean, if this were become a kind of a mainstream health service that got reimbursed, would we ruin it because we take away that passion?
I don't think so, because there's already reimbursement. So there's already opportunities for insurance reimbursements for this type of care. Yes, there are certainly people that have like boutique type services that they're paying for, where they want to integrate with the horse to have some type of healing or helping. And then there's a lot of facilities out there that never turn away a person already. So they are already operating on we serve everybody, and we want to make sure that everybody has the opportunity to heal, regardless of their ability to pay. And so across the board, I don't think that it would, because being around horses and taking care of the horses requires so much of your time. Like, you really do have to be engaged in that process, that I don't think it would remove the passion at all, because you have to like horses, and you have to like being outdoors in all weather. So it's a form of farming where the product is the relationship with the horse, not a product that you're consuming or selling then.
Can you comment a little bit about the physiological relationship between horses and humans? Because that's an area that I find absolutely fascinating. So I want to read it more into it than is probably there, but I do find it fascinating, that relationship that horses and humans have physiologically.
Yeah, so there's definitely been work relative to the heart rate variability aspects. So in other words, horses naturally want to stay in a parasympathetic state, which means that they're in the rest and digest. They want to be calm, bonded in their group. And they do stay aware, right? So that if they need to go into the flight or fight. And so there's some research that's showing that there are human responses to where being around the horse helps bring that individual, the person, into that parasympathetic. And so the
Which
hormones,
is particularly relevant for people who've experienced traumatic stress or neurodevelopmentally diverse people who struggle with that kind of regulation.
That's absolutely right. And so there are some great works on neuroimaging. I'm not a neurobiologist, but I want to be because it's so fascinating of looking at how there's actually the upregulation of the prefrontal cortex and then the downregulation of the amygdala, so that that's occurring when there's interactions with the horse. I have this dream of putting an EEG on a horse someday. I've talked to many of my collaborators on this. I want to put on an EEG on a horse and on a person at the same time because I want to see what's actually going on.
So you have some questions so what are the essential elements of good equine-assisted intervention services? Are there studies looking at implementation?
Yeah, absolutely. So there are some really great organizations that actually provide oversight of what standards of practice should be. Some of the things that need to be addressed, essential elements are obviously safety. We have to do that. And when I say safety, it's that not just the physical safety, but it's that psychosocial safety. It's the environmental safety that occur in that. And then it's also making sure that you have documentation and that you actually are measuring outcomes. And a lot of the outcomes measurement in the past have been really focused in on numbers served, right? Because they're trying to get funding. So it's been numbers served, number of youth, number of horses that you have, that sort of thing. And we want to shift that conversation into transformation. How do we transform those lives? So part of those standards of practice need to actually include what should we measure and how should we measure that? And that's a continued conversation that we're having.
Great. So there was a request for the reference list and a comment that you provided an awful lot of information in a short period of time. So just to let everybody know, this will be recorded. This is recorded. This has been recorded. And the recording will post on the TCOM channel on the YouTube. So you can go back and look at it as often times as you want to and digest all this information, because there's a lot of information. There was a question now from Alejandra. Which is, could you please tell me if there's an article or document that describes or integrates specific benefits that different diagnoses get from equine-assisted interventions? So in other words, is there a nice systematic review or a summary review that kind of directs you to which types of folks might be most likely to benefit?
I really appreciate you bringing this up. No, this is great. So I'm not familiar with one that actually looks at different diagnoses. There are some amazing reviews that look at within a diagnosis. So PTSD, autism, other physical dysfunction. But that being said, one of the directions that we're working on right now in the IF Center is actually trying to evaluate, for instance, autism. How are strengths built in traditional services, so that then we can answer the question, how is that mirrored or changed or better in those that are actually working with horses as well? So other people may know of one document. I don't know. There are some really great resources that are out there, but one document that compares all of them, no. And I agree. Maybe I need to write that.
And it seems like that's the ideal kind of application of the reservoir approach, that if we can kind of get the population and look at how people change generally, then we can compare specific interventions to that without having to do these one-off randomized clinical trials that don't necessarily represent what actually happens in reality. So that's great that you're moving in that direction. Another question is the difference between faith-based and secular programs. And I'd actually ask to expand that, because my guess is there's no intervention that it's just the horse. I'm trying to picture a horse coming out of the barn and, saying next. So I don't think that ever happens, right? So there is a human being that is also working with the person. So you've got three things going on, right? You have the horse, you have the human who is modeling their relationship with that horse, and then you may have other things like faith and spirituality and so forth. And that is another thing that's happening all at the same time. So any ideas about untangling that in your mind, or what you think this current understanding shows?
Yeah, and there's a lot of question out there, even what type of people. Is it a horse professional, or is it a licensed counselor?
Mm-hmm.
Who needs to be part of that team? So it's not just a person, a participant, so the person that's intended to heal, and then some other people around and a horse. It's what are the dynamics of that interaction that are occurring. And I from my observations and looking at this, when you have organizations and people that have a shared vision, then what you see is an environment that is automatically more conducive to healing. And that includes the horse and the humans. And so if we translate that into this idea of faith-based, non-secular and secular programs, is we need to ask the question even more: is it more about what is the culture that is occurring within that organization? And specifically to our study, with the secular, non-secular, we're still working on the program data. So we actually have a lot of really good information on, are there different practices? Are there different values? It's just not something that we covered today.
Right. That'll be interesting. So, and Anne shared that they have a equine specialist and a licensed mental health professional working together, which that's another model, right? That's interesting. So.
Yeah, so that's a very common model, because it's important that someone is watching that horse. So back to the kind of that safety discussion, is that we have a responsibility for not only the safety of the individual that's receiving the healing intervention, but also for the horse too. And so when you have an equine professional and a licensed mental health professional, that team becomes really important in making sure that the entire environment is safe. And so what I, kind of back to Trisha's question, we don't know yet. If you overlay now faith onto that team approach, is that different? And that's a really interesting question.
Right. Yeah. And in what way is it different? Is it
In what way?
Because you're absolutely right. I've been to residential programs, for instance, that are faith-based, and a part of what it does is it creates this very consistent way of being with other people. And I think that's extremely helpful, almost no matter what the consistent way of being with other people is. But there might be also things that are about, people developing their own spirituality and so forth that becomes relevant. So untangling all those threads is a really interesting and complicated whole health challenge.
Yeah. And we know that horses don't experience religion and faith the same way that a human does.
Are we sure?
Well, to my knowledge, my horse has not approached me about trying to learn more about a specific religion or denomination. But that being said, I think the intentionality. So moving beyond this concept of approach and having standards, and moving into what is that intentionality as we talk to individuals and work in that healing environment, it can be translated into benefits across the page.
Right. Well, we are coming to the end of our time together. Thank you so very much for your insightful and inspiring presentation. It's absolutely fascinating, and I think I look forward to seeing where you take this work in the future. So hopefully you'll come back and do another one after a period of time. So I also want to thank all of you who were able to come, and those of you watching on YouTube. I would tell you that there's another seminar series, a What If seminar series coming up. The next one is What If money management is an important part of well-being. And so we're going to have some financial experts to talk to us about their perspectives on that. So thank you again, Dr. Tumlin, for your wonderful work. Thank you, everybody who's on this call for all that you do for others. I know some of you go way above and beyond, so thank you for that. And we look forward to our continued work together on behalf of the people we serve. So thank you, everybody.
Hi, I'm Brandon.
And hi, I'm Kendra.
We work with the Center for Innovation in Population Health, and we're really excited to be establishing the Equip Partnership.
We really see it as a community, a gathering place where helping professionals who serve as qualified individuals can come together, share, to learn, to grow.
We at the IT Center, we're generating content such as YouTube events, pre-recorded videos, and much more.
We recently had the opportunity to speak with the Honorable David Guyton from York County Family Court. Please join Equip for a special live event on April 4th where we discuss our interview with Judge Guyton and explore the important role our family courts play in supporting children and making placement decisions. We hope to see you soon. Join and learn more at eqypartnership.org.
Thank you for the work that you do on behalf of children and families.